because right now, all the media talks about, and in a way, rightfully so, because people are dying and the disease, the COVID-19 is highly contagious. And we see that now it's mutating into even more contagious forms, at least in the UK. But before COVID-19, about a year ago, the big numbers that people were looking at were the 40 million people dying prematurely each year because of non-communicable diseases, chronic diseases that poor lifestyle choices were triggering. You mentioned cancer, Alzheimer, of course, but strokes, heart disease, pulmonary, respiratory diseases also. At the time, with 40 million people dying every year, that's about a person dying prematurely every 0.9 seconds.
Correct.
So wasn't it already then, and isn't it again now, a fantastic opportunity for owners, spa directors, spa managers, anyone in the spa industry to train, be as sharp as they can, be as open, be as resilient as possible, but to provide amazing services for those regular clients, those locals, to help them be on a wellness journey or a well-being journey, if you don't really like wellness as a word, but definitely a health, helping, being guides or being Sherpas, if you want, if we were mountain guides, Sherpas in life, because now that's, and I'll stop on in just a second, but we're January 6th. Everyone has been wishing wonderful wishes for the new year. And we know that wellness resolutions or New Year resolutions last about as long as the month of January, and definitely by Valentine's Day, they're going to be out the door. So how do we as an industry help those regular guests come and embark on a journey where we can guide them towards better health, physical and mental? Because that's definitely been something you've been tackling with ESPA for years, for decades.
So I think the challenge now, if I take the projects I was working on before COVID, all those things you've been talking about, we were already tackling. So we were predicting they were coming. So where I feel quite strongly, and what you say is very motivating and absolutely correct. However, we're dealing with young therapists who really, as they come out of college, have no lifestyle experience, life experience, and they have minimal qualifications very often in their anatomy and physiology. So in a way, we have to break it down into bite sizes. And one of the things when I had ESPA, and we had a wonderful training team who worked with me for over 20 years, was we tried to graduate the training according to the skill set of the therapist. So when we talk about these lifestyle diseases, what I found in my research was there is so much commonality. And a lot of it has come about over the last 30, 40 years because of the way what we have all been doing with our food. We all know about that, our soil, sugar, sleep, all the things that we all know and we're talking about and is all on trend. However, how do we deal with it? That is another big ask. So while we're in this period, I think that we should be, there's several things we should be doing. We have to look at all the contraindications for each of those lifestyle diseases. So each owner, each spa director, there's a lot of information out there. Everything must be evidence-based. I'm big on evidence-based. And one of your questions was, how can we help governments and local councils and so on? And a lot of it is to do with evidence-based. So we mustn't try and be nurses, and we mustn't try and be medical, and we mustn't try and be doctors. Integrative health is the way forward. So if we look at the contraindications, we look at the signs, we look at the symptoms, and we give the therapist those skills, but you have to do it piece by piece. And one of the reasons I wanted to do cancer first, because I think by doing cancer, it will help with the others, because empathy has a lot to do with it. Understanding personality types has a lot to do with it. As you know, I studied Ayurveda and Chinese medicine, and we started to incorporate that into all our training. And I think that is important, looking at personality types. so that the young ones in particular start to recognize not just the symptoms, but also the type of people they're dealing with, so that they have the right words, the right terminology. It isn't all about practical, it's about psychological, and it's also about case histories and bodies. So say you decide that as a topic you are going to do cancer. Cancer is the easiest one to do first because the training is there ready to go for anybody who's done their stage 3. Type 2 diabetes is one of the biggest ones. Everything respiratory is also big. So think, if you've got the budget, like the hotels, I'm a great believer in things like oxygen training, hyperbaric, breath work. And that's what when we talk about light wellness and the much more serious wellness or well-being, we have to define again what your therapist can deliver. But I think if you take one topic at a time, and on top of all their anatomy, physiology, as long as they've got their anatomy, physiology, and they understand the body, then you can build modules quite quickly. But then don't do 3 or 4 at a time because they can't cope with it. So you want to give them one module, let them practice, even if you have a half a day a week where you invite people in to be bodies who can't afford to come normally, and they've got that issue, and let them practice on those people, or go into hospices. If they go into the hospices are crying out for therapists to help their patients. They'll get so much experience. And then you move on to the next one and the next one and so on. And it wouldn't take too long, and it's not, a lot of it can be done online. So for me, that's, excuse me, that's a start. The life skills, it's just keep training, isn't it? It's finding that balance. I think hotels now will recognize the importance of wellness. And as I say many times, it's not just the spa, it's going to be the whole hotel. So they're going to have to look at the food and everything else, and the rooms and sleep and everything. But if you've got a nutritionist on staff, or you've got a naturopath, as I think we will increasingly have to have, we're going to have experts, whether they be acupuncturists, as you say, TCM practitioners, nutritionists, personal trainers, sports scientists, whatever they are, use them to help, use the cross training of all this information and expertise, invite specialists in to help. The way we've set up the SATCC is that if you're a level 3, if you've got level 3, you actually can do your training in about 3 days, and some of it can be done online. Then you can go to another level. So we put standards in place for, if you like, everybody. And then we're putting advanced standards together for things like lymphedema and other things. But as I said, I think empathy has a lot to do with it, and listening. And there's things that we can much more easily challenge and do in the industry, but again, not be over ambitious. I mean, I think we've got to be ambitious. We've always got to be ambitious, but don't be over it, and don't make claims. Don't make false claims, because then we'll be in trouble as an industry. If we want people to take us seriously, then we have to. But I think going forward, if we can get the evidence-based piece right, and the microbiome, there's another subject we could start on. I've been bashing on about the microbiome for at least 10 years, if not longer. But if we can get that piece right, then I think we can underpin the national health. We can really help to underpin. But we've got to be careful, because there's a big difference between, and I'm not belittling anything, everything's important, but at this point in time, my personal opinion is that the internal wellness, well-being, body work, breath work is at the moment a little bit more important than the beauty side. Now, that is in no way to belittle beauty. There's times when beauty is really important, especially if you've been through cancer and you've been wearing wigs and things like that. But at the moment, I think we're looking at the health of the nation or the world, if you like. And as an industry, we can focus on that and we can really help with that. But it's baby steps. I don't think we should try and conquer it all, because we're not going to have the therapists and the specialists. Although I do think we're going to start to have nurses more coming into our profession, because they're going to be burnt out after all of this.